Hey everybody, this is Dr. Eric Nepute, and on this edition of Adjusting Your Attitude, I want to talk to you a little bit about genetics. Do you remember back in school when we were talking about your genes? And I remember when I was a kid, I used to read in my weekly reader every week. We talk about cell biology and genetics, and they used to tell us that we are our parents' genetics. We are our genes, and your genes don't change, and you have your DNA, and that's just the way it's going to be. Well, that's not true. We now know, because of the study of epigenetics, and cellular biologists like Bruce Lipton and many others have proven that our DNA and our genes can change. Now, some genes don't change, like my genes for my hair to be red isn't going to change. You know, my genes for my eyes to be a different color, it's not going to change. At least we don't know how to change that yet. But we do know that certain genes turn on and turn off depending upon how much stress our body's under and how our body adapts to it. So there are genes that turn on and turn off for cancer. There are genes that turn on and turn off for heart disease. Genes that turn on and turn off for everything from diabetes to cancer to you name it. And so we know that those genes can be positively manipulated by balancing out your stress. So what I'm trying to tell you is, we've talked before about the balance in your brain. If your gas pedal's stuck on go, if your sympathetics are too high, your brakes don't work. And if your brakes don't work, your body can't adapt. It can't develop. It can't get better. So we can change your DNA by actually getting your body balanced out. So you've heard of people like, and this is last year, Angelina Jolie and many other women went and had their breast removed because they had a genetic predisposition for breast cancer. We now know that that is not true. These poor women that went and had their breasts removed shouldn't have had that done. They did it in the name of science, and the science was wrong. How crazy is that? So we know that our genes can turn on and turn off based upon a good lifestyle, based upon good foods, good nutrition, balanced brainwave pattern, good spinal alignment and adjusting. This is a powerful thing. There was a study that was done in the early 90s, and this study looked at telomeres. Telomeres they're a part of our DNA, and the bottom line is the higher your telomeres are in your body, the better your DNA is, the healthier it is. And so there was a study done, and they looked at telomeres. And what they found was that the highest number of telomeres that a person had was around 120. So if you were considered around 120, you were the healthiest a person could be. Okay, and this is DNA. Well, the geneticist who discovered this was really good friends with a guy who was a chiropractor, literally next door neighbors. And he says, well, I want to run that test on all my people. So he ran this test on his wife, on his workers, on his team, and a lot of his patients that have been with him for 10 or 15 years. And the geneticist came back and said, these numbers can't be right. We're seeing numbers up into the 140s and 150s. This can't be right. Let's redo it. Well, they found again the numbers were in the 140s and 150s. And you know what the one common denominator was with all this chiropractor's patients were? Is they were getting regular, consistent chiropractic adjustments. The majority of them had been adjusted at least once a week for about 5 to 10 years. They had the healthiest genes and DNA on the planet. We now know that you can change your DNA because of the study of epigenetics by getting regular, consistent chiropractic adjustments. Now people are saying, why isn't this on every TV show? Why isn't this on every commercial? Because every third commercial is about drugs. Do you think that the drug companies want you to know that this is possible? Do you think that the American Medical Association, who's paying billions of dollars a year in advertising, wants you to know that you should go see the chiropractors where they don't make a dime off of us? Of course not. Follow the money and you'll follow the results. So I just wanted to take a minute and share with you that you are not your genes. Just because your mother had high blood pressure, your father died at 40, that doesn't mean that you have to. You are who you are based off of what you consistently do. So please get plugged into what we're teaching. If you got questions about this, ask us some more. Call us at 314-544-5600, and we will see you and your family on your next visit. Have a great day.